Hello, I'm in the T-Mobile break room here with one of my coworkers, Josh. Hi, Josh.
Hi.
He used to be a ER? Medical assistant. So he knows what I'm talking about. I had him put together my puzzle. He did a great job. And now I'm kind of just going to show him what everything is and show you guys as well. Okay, so this is my little model I did. It's all a ton of different pieces that are laid together to kind of fit one whole thing. And it's supposed to show the deoxygenated blood, the oxygenated blood, and the path that it kind of takes. And I'm just going to go over that. So deoxygenated blood comes from either the head and neck or the rest of the body through the superior vena cava and the inferior vena cava, which is number 12 and number 13 here. This is the superior, this is the inferior. They empty into the right atrium, which has valves that close, and then they push the blood to the right ventricle. The right atrium is going to be number 3 here, and then the right ventricle is going to be number 4. The reasons it's flipped is because we're always acting like we're looking at a patient's body, not at our own, so that's why it's a little bit flipped. The right ventricle closes and builds up like a lot of pressure, which moves the blood to the pulmonary artery, which is shown as number 11 here, which is going to be this guy, the little blue guy here that kind of comes in with the little hand. And then the pulmonary means that it's going to the lungs, and artery meaning it's leaving the heart. So that's kind of what it's doing. And the lungs are number 1 and 2 here. You can see that the artery kind of comes out and dumps the blood then into the lungs. And then what happens is there's the split in the pulmonary artery that goes to the right and left lung. And it's kind of hard to see here, but there is a little split in the little blue on the end there, and that's supposed to go from the right and left. And then it goes, the blood goes through the smaller and smaller vessels that starts with the artery, the arterial, and then the capillaries, where it drops off carbon dioxide and picks up oxygen in the capillaries because they're so thin, so gases can move through them. It heads back through the venule, then into the veins, back to the heart, on the left side of the heart, through the left pulmonary vein, which is going to be number 10, and then the right is number 9 there. And it goes through the left side there, you see the 2 little tubes. Goes through the left pulmonary vein, which comes into the left atrium, which is going to be number 5 right there. You can see it kind of coming into there. And then same thing as the right side, in the left atrium, it builds up some pressure and then squirts the blood into the left ventricle, which is number 6. And then that builds up even more pressure, a lot of pressure, and then pushes blood into the aorta, which is number 8. And then the aorta splits into the ascending, which is going to the head and up with oxygenated blood. So at this point, it has become oxygenated from deoxygenated. And then we also have the descending aorta, which is going to be number 14 here, which you kind of is a weird way, but it kind of comes up and around, which takes oxygenated blood down to the rest of the body. There's also cardiac muscle that helps to contract and kind of move blood around, and that's going to be 7 here. It's this little kind of like stuff that just lines the heart, and that is cardiac muscle. So that is my little puzzle that shows the movement of blood through the body.